Hello everyone, hope you're all doing well. If it's your first time on this channel, my name is Hafiz and I'm a cardiologist training in London. Here I create videos educating on all aspects of heart health and cardiology. If that's something you're wanting to learn more about, then hit the subscribe button and the bell icon so you're up to date with all the videos. In this video, I'll be speaking about the top 5 signs and symptoms to look out for that may indicate a failing heart. I've done a whole separate video explaining heart failure and how it's diagnosed and its general management. In this video, I want to focus on the top 5 signs and symptoms we commonly see when patients present with heart failure for the first time, either in the emergency department or when they get referred to us by their family doctor. So let's find out what those 5 signs are. The number one biggest symptom is breathlessness. Remember, in heart failure, your heart can't keep up with your body's requirements. So when you exert yourself, your heart essentially tells your body, I can't keep up, so you feel this as being breathless. Sometimes patients report breathlessness at night, particularly when lying flat. This is because in heart failure you get fluid buildup in your lungs, which worsens when you lie flat. So patients with heart failure often use a few pillows to help them breathe and be more comfortable when sleeping. The second most common symptom is swelling or edema. This typically happens in the extremities, usually around the ankles. This again is due to the buildup of fluid due to the inadequate pumping action of the failing heart. I often hear patients report that the swelling is worse as the day progresses and is better when they wake up in the morning. That's just due to the effects of gravity, pushing the fluid to your extremities throughout the day. The third common sign is weight gain. Because there is fluid buildup in your body, you may notice that you have gained weight. In heart failure management, we often ask patients to tell us their dry weight, meaning their weight when there isn't buildup of fluid in their body. This helps us understand roughly how much to titrate their medication dosages and what weight to aim for. The fourth most common sign is palpitations. When we see patients in the emergency department with heart failure, either as a first presentation or as a result of a decompensation, we often see that their heart rate is high. This is because the weak heart is overcompensating as it's struggling to meet the body's demands, so it speeds up, and this is why you may experience palpitations. The heart may also go into an abnormal rhythm, most commonly atrial fibrillation. I've done a separate video on AF and I'll link it here somewhere on the screen. And finally, the fifth most common symptom is a little vaguer, and that's general tiredness or fatigue. I often hear patients who have recently been diagnosed with heart failure say that they are really tired all the time. This is because due to the underlying physiology. The weak heart is desperately trying to keep up, and as a result, you feel tired and fatigued. So just to recap, the top 5 symptoms are breathlessness, swelling, weight gain, palpitations, and general tiredness. Do you suffer from heart failure, or do you know somebody with heart failure? Tell me in the comments below which symptoms you felt. Was it these top 5 symptoms or something different? I'll be interested to know. I hope that was helpful, and thanks for watching.